Hi, I'm Dr. David Goodman. I'm an adult psychiatrist specializing in ADHD in adults and older adults. I'm on the faculty of Johns Hopkins School of Medicine as well as SUNY Upstate. So I'm welcomed here today to talk about stimulants and a hot off the press publication about deprescribing stimulants and the appropriateness and what clinical settings you would consider doing that in. With the current controversy about the prescription of stimulant medications and the questionable accuracy of psychiatric diagnoses for ADHD, it becomes very pertinent for all clinicians and prescribers to understand how to go about thoughtfully prescribing stimulants and then when to consider under what clinical circumstances to diminish the dose and perhaps take the patient off the medication. So the current publication just came out, and it was orchestrated by the American Society for Clinical Psychopharmacologists, in which we brought together 45 national and internationally renowned psychopharmacologists for a expert consensus recommendations for psychotropic medications and deprescribing across the board. We broke out stimulants as a very specific class of medications because of concerns and controversies. So we went through a Delphi method, which is an iterative process of reviewing specific statements for clinical recommendations. And we had 11. We reached consensus, which is a 75% or greater agreement. That is strong and very strong agreements. There was one outstanding, and I'll hold that as a teaser for a moment. But the purpose of this exercise was to codify a certain approach, establishing a standard of care for the prescription and consideration for deprescribing stimulant medications. Now, when I say deprescribing stimulant medications, this is not in line with the current public discourse about stopping medication. The deprescribing occurs in very specific clinical circumstances where a thoughtful prescriber is going to consider decreasing and stopping stimulant medications. When we submitted the manuscript, one of the remarks by the reviewer was that these recommendations were kind of a duh experience. This is generally good medical practice. And so why did we need this publication? And our response to the reviewer was, yes, we agree. But given that many and a lot of the psychotropic medications are now written by non-psychiatrists who have been inadequately trained in how to prescribe, how to diagnose, what kind of dosing to prescribe, the American Society for Clinical Psychopharmacologists decided this was necessary to put in the publication and establish a standard of care in approaching the appropriate prescription of stimulant medications. And then when you consider deprescribing stimulant medications, and this can be not only for adult ADHD, but it can be for a broad range of psychiatric disorders for which stimulants might be used, and then for how long they would continue to be prescribed. We have several publications. One was a general deprescribing for psychotropic medications, which has been published. The second is the deprescription of medications in mood disorders. This publication on deprescribing stimulants in adult ADHD is the third, and there is yet another manuscript in development on deprescribing antipsychotics. So the American Society for Clinical Psychopharmacologists, ASCP for short, is developing these manuscripts and publications in order to establish a standard of care of not only when you write psychotropic medications appropriately, but also when you consider the patient is on several medications, are they all serving an effective benefit? And can the cocktail, if you will, be narrowed to those which are critical for stability and those which are no longer necessary in the treatment of the patient? We have two FDA-approved non-stimulants, atomoxetine and viloxazine. We will very likely, in short order, have a third non-stimulant called centanafidine. And so we are broadening out the options of non-stimulants. Heretofore, it had always been thought that non-stimulants ought to be a second choice because of the effectiveness and tolerability of stimulant medications. But there are an increasing number of publications that are questioning that approach and perhaps maybe considering using non-stimulants, especially in the newly diagnosed who have not been prescribed stimulant medications. In the literature, atomoxetine may be useful when the patient is stimulant naive, but it often is the case that when the patient can't tolerate or isn't responding to a stimulant medication, that atomoxetine may not pick up a benefit there. So it depends on the sequence of how you prescribe these medications in order to determine which is first, second, and third in your pharmacologic algorithm for adult ADHD. I want to highlight the purpose of publications of expert consensus and clinical practice guidelines is to advance patient care. It is the consolidation of the research and the clinical experience of people who have decades working with patients. While many of these guidelines might appear to most psychiatrists as routine medical care, again, I want to remind everyone that over 90% of antidepressants are prescribed by non-psychiatrists. Almost 50% of all stimulants are written by non-psychiatrists. And these are folks who need clinical guidance. They don't read the psychiatric research and literature. And putting this information out is really important to establishing and advancing standard of cares. Now, these recommendations and clinical practice guidelines, which are separate, by the way, expert consensus is separate from the more rigorous scientific endeavor of clinical practice guidelines. Nevertheless, all of this, though, contributes to setting expectations for patients as to what is quality of care so that they can understand when they are receiving a quality of care. It also is important for educational benefit because it alerts programs that maybe we need to update our curriculum and include the most recent state-of-the-art recommendations in the clinical care of psychiatric patients and adult ADHD patients specifically. The other stakeholders involved here are insurance companies that can then update what practices are reimbursable. It has medical legal implications as such. Expert guidelines and clinical practice guidelines are cited in medical legal cases. And last but not least are legislative and policymakers who are involved with establishing policies for moving forward with science for the benefit of patient care.